Hi, I am Dr. Judy Gooch and a rehabilitation doctor, and we are giving a series of these YouTube live sessions about once a month on a topic related to typically to brain injury. And I want to do live sessions because on the channel, on the videos that we have on the channel, people will ask questions, make comments, and I just wanted to give people the opportunity to ask those questions live. Today, I've got Nancy Murray here, and Nancy is an audiologist and a speech language pathologist and has worked with people with brain injury for 30 some years, and also with people with auditory processing disorder. And that's what she's going to talk about today. The reason we're talking about auditory processing is that we have quite a few videos on the Utah Neurorehabilitation YouTube channel on auditory processing. And that is the topic that gets the most comments and questions. So here's Nancy.
Hi, and thank you for joining us tonight. And thank you, Dr. Gooch, for introducing me. So I am going to talk about auditory processing. Auditory processing, in the simplest form, is what the brain does with what the brain hears. We communicate with one another, we learn, we live in a verbal world. We have to be able to process what is said. I can hear something, but if I don't understand it, that can cause a problem. So we all mishear things. Someone may say something, or there's a lyric in a song and we twist it around a little bit. We all do that periodically. But if it happens on a regular basis, then it becomes a problem. It will affect learning, it can affect behavior, and that results, or when it happens very frequently, it results in an auditory processing deficit or disorder. So most people with auditory processing problems have normal hearing, and they'll say, my hearing's fine, I can hear. The issue is people may not understand when directions are coming too fast. If I'm speaking really fast and going through everything like that, people may not understand what was said. So there are strategies and things to be used. But first, I want to go back and talk a little bit more about it. Like I said, people generally have normal hearing. So something drops on the floor, I look that way and see it. An alarm rings, I look to see what's going on with that. Some people can ignore those and go on with what they're doing, or they can acknowledge, oh, I heard something drop, but it doesn't pull me away. But if the sound is pulling you away from what you're trying to focus on, if you have something on a desk that you're working on, then it can become a problem. And that's when it looks more like an auditory processing disorder. Now, there are many people that even have talked to me about hearing a conversation in another room or down the hall, and they actually hear that better than what they hear with someone talking right to them. And it's really the brain's inability to filter out the sound that the brain doesn't need. Causes of auditory processing disorders are wide and varied. A child can have it from ear infections, after a stroke, after any type of brain injury. It's a possibility to have an auditory processing disorder. So what does it affect? Like I said just a little bit ago, when you talk and we communicate, we live in a verbal world. We're listening. We're talking to one another. So my social life can be affected if I have an auditory processing disorder. Learning. So if you're in school or at work and in a learning environment. Behavior. Many people with auditory processing disorders are really overworking the brain. They're working hard to hear or to listen to what's being said. They're working hard to ignore that interfering noise and are very, very tired at the end of a school day or at the end of a work day. That can often result in people being extremely irritable or just shutting down, withdrawing from family, withdrawing from friends. So it affects, or auditory processing deficits can affect the lives of brain injured people in just about every aspect of the life. So how do you know if you have an auditory processing disorder? Have people told you you're not listening to them? Have people told you just pay attention? Have they told you you're not focused? Do you have trouble remembering things you've been told? Do you like using closed caption on the TV or movies, more of those verbal medias? Do you like seeing the words to help you? If you have a child and you suspect an auditory processing disorder, are they having trouble learning to read? Are they struggling with spelling? Are they struggling in school in general? Auditory processing, again, can affect every aspect of a person's life. So whether it's school, work, social relationships. And I think one thing that is important to know, auditory processing disorders can be treated and things can get better. And before I go into that, I want to talk just a little bit more about how auditory processing can present. It's hard to understand it. It's a complex and evasive concept. If you break an arm, you may have a cast. If you break a leg, you may have a cast. But when you're not processing sound very well, there's really nothing to tell somebody that you're having trouble with that. And I think one way to describe it is to think of a cell phone. And almost all of us have cell phones. Almost all of us have experienced a time where that cell phone is cutting in and out. An auditory processing disorder is like that cell phone that is cutting in and out. My brain is that cell phone, and I have information coming in. But if the cell phone's cutting in and out, it drops some of the words, or it drops even a portion of the word. And then I have to focus very hard. I have to fill it in. It may sound muffled. So if I'm speaking like this, so if I was speaking like that and my voice is muffled, that's harder to understand. I have to lean in a little bit more. I have to focus on what it is. Well, that is what an auditory processing disorder can be like. And think of it. It's not just in certain places. It's not something that you can say when you're on that phone conversation. You can say to somebody, oh, I'm in a really bad place. It's cutting in and out. Let me call you back. The person with an auditory processing disorder is not able to go to a better place. They're not able to just call back. They're living with this day in and day out, all day long. So that's one way, or a couple of ways that it's like to have an auditory processing disorder. So I said a little bit ago that it's treatable. What can you do for an auditory processing disorder? There are hearing aids that are designed for auditory processing disorders. Many people think that hearing aids are designed for older people that can't hear, and we need to make sound louder. We need to boost it. That's not very helpful to people with an auditory processing disorder. And these hearing aids actually add a filter. They will take the speech frequency range or the speech sounds and boost them just a really small amount. But they add a filter to help decrease all the clutter noise or all the background noise. So then it's easier for the brain to listen and to hear the target sound. The other thing, depending on the person and what they need them for, their age and recovery, the hearing aids are not necessarily meant lifelong, but they do help the brain refocus, retrain, and become more functional. There are sound and music programs designed to help with auditory processing. And again, they're very specific programs. You need to meet with somebody, and if it's an auditory processing type that you have that would be appropriate, then a particular music or sound program may be recommended. Somebody would set it up for you, and then there would be a protocol that would be followed. And then there are strategies. So for somebody with a brain injury, if there are memory problems, you work on strategies in order to help remember things, to help boost your ability to use different strategies. So I think that this is a very quick overview of what an auditory processing disorder is. And I want to give you a few examples of people that I've worked with over the years. I have worked with a 28-year-old young man who was extremely frustrated with life, very depressed, very isolated. He actually was diagnosed with an auditory processing disorder as a young child after a fall on a playground. And he received traditional therapies of some speech therapy, some occupational therapy, but no one ever really addressed the auditory processing. He was very sensitive to sounds, wouldn't want to go into gymnasiums, didn't want to go to birthday parties. Well, as a young adult, I saw him, we fit him with these specialized hearing aids, and he's working on a music program. And it's amazing the transformation he's made in just the last few months. I've just started working with him about 4 months ago. He is liking work better. He's not as tired. He's starting to go out with friends more. It's really done a big, big help to him by coming and seeing and getting treatment. He didn't do additional speech or occupational therapy, but he is doing the music therapy as well as using the hearing aids. Another young girl I worked with, 4-year-old Anne. She had meltdowns, covering her ears, screaming, hitting peers, not following directions. She had been kicked out of one preschool. Parents didn't know what to do. They've done behavioral therapy, following all those recommendations, and somehow it came across their desk or their eyes about this auditory processing. And they had her hearing checked, and hearing's fine. The doctors said, hearing's fine, she's just a behavior problem. But then they delved more into the auditory processing, and they pursued it a bit more on their own. Sure enough, she was tested. She has an auditory processing disorder. She was fit with the hearing aids. She's doing occupational therapy and a music program and making huge strides. Meltdowns have almost disappeared. And the meltdowns she does have are very small now. Another person I worked with, again, a young adult, 18-year-old, who actually had tried for over a year to pass driver's education test. He kept saying he couldn't do it because it was too noisy, and people kept saying, it's quiet in there, it's quiet. But the noise that Jordan was hearing were fans going on and off, people walking in and out of the driver license bureau area. They're off on a side, but it's not in a quiet room. And again, he was tested and he was fit for hearing aids. He is doing some therapy, including some music therapy. And his first comment was he doesn't come home from school and take a nap every day. He used to be extremely fatigued, and he didn't even know how fatigued he was. And the next time he went in to take his driver's ed test after being fit with the hearing aids, he passed it first time through. So this is really a quick overview of what an auditory processing disorder is. And it's important to know that there are different types of auditory processing disorders. We're not going to go into that tonight, but there are different types. And I think the real takeaway is there is treatment for it. People that have had a brain injury are more susceptible to having problems with auditory processing. And more of it is the interference with sound, not so much that I can't hear, but it's that I get overwhelmed with sound. We do have a chat, so I'm going to look and see if there are any questions.
I have, I just have to say thank you, Nancy. And I just can imagine how fatiguing and frustrating it must be. And I just wanted to ask, is it relatively common in someone who's had a brain injury?
It is. It is very common for people with brain injury, and it is often overlooked. And that's a really important concept. Many people after brain injury contend with depression, contend with overstimulation, and auditory processing is highly, highly correlated with brain injury, with depression, with anxiety. So it is something that gets overlooked. Again, you come into the hospital, and like I said earlier, if you broke an arm, you could get it casted. When you hit your head or you're in a big car accident, you have all these other physical things. Those are the things that often get attended to. The brain injury often gets forgotten. And that becomes a big issue because the hearing, it often doesn't get checked.
And it's not I think you told me that it's not looked at typically on a neuropsychological testing. So somebody can go through a whole battery of neuropsych tests and not have their auditory processing skills looked at. Is that correct?
Yes. The person that diagnoses an auditory processing disorder is the audiologist. And many of you that are listening or hear this, I'll say to you, how many of you have even seen a hearing specialist after this? Very few, I would guess. And so it is something that even though you've had your neuropsych testing, you've had your occupational therapy, you've had your speech therapy, it often does get missed. There are things to look at with this as well. When you get that neuropsych testing, sometimes people come out and they have executive function challenges. Well, where are those executive function weaknesses? And is your visual processing or nonverbal skill level much higher than, say, your working memory or processing speed in general? Those are hints. And auditory processing, and somebody on here, Deb, has brought up a couple things, and we've talked about brain injury as being a hidden disability. Auditory processing is probably even more hidden than a brain injury. It can be part of it, but it's very, very hard because people can hear, but they just don't hear the same way, and they just don't get the same sounds through to the brain.
Yes, Deb is on the chat here from Nottingham, England, where I believe it's 2 a.m. So looks like you're up pretty late. And Deb stated, I've had a hypoxic brain injury. Never give up on yourself. Keep going. I am all for that. After brain injury, sometimes in the medical profession, it's stated that, after a year, you're not going to improve. After 2 years, you're not going to improve. That's just simply not true. And so thank you, Deb, for pushing that to never give up. That's true.
That is really important. And I think people with brain injury recover and change for years. It is years. It's really a lifelong recovery for most people. And things definitely change.
Okay, well, thank you, Nancy. That was very helpful.
Well, I'm glad. Keep on working, people. Oh.